Hello and welcome to the AbstractMedic YouTube channel. Make sure you like, comment and subscribe. Okay, today we're going to go through the long-awaited video that I've been meaning to make for literally so long. I'm going to go through how to do well and pass your UKMLA/AKT exam. So this is an exam that happens in the UK, that's basically written in the UK by final year medical students. I wrote the exam in my 5th year of medical school. I did the UKMLA pilot. So basically I had the opportunity to get a feel for what the exam would be like. I think now it's actually used as a real exam, but before, like I said, I did the pilot so I can point people towards how to approach the exam. So let's get into it. First and foremost, I would always advise that you familiarize yourself with the UKMLA content map. I'll show it on the screen. It's important for you to have a look through that. The way I approached it, because I know it can be quite overwhelming, I kind of looked at the conditions list and I worked my way through the conditions list because the presentations list is very, very vague, like chest pain. So many different things can cause chest pain. Breathlessness, so many different things could cause breathlessness. So I kind of worked my way through the conditions list with the hopes that by default I'll be checking off multiple different conditions that fall under particular presentations. So that way it was a lot less overwhelming for me. And even though in the end there might be other things that cause breathlessness, for example, that may not be explicitly listed in the conditions list, I had the confidence that if I knew that I had gone through the conditions list, for the most part, whatever comes up in the exam, I'd be able to answer. So that's my number one tip. Go through that UKMLA map, the content map, work through it, familiarize yourself and use it as like a checklist in your revision. Don't forget about it at all because it helps a lot. When you finally learn the different conditions that is expected of you to know specifically, then when it comes to an exam question, when you're stuck, you can kind of think back to that map and be like, what is it that was explicitly listed? What is it that these people want me to know? I think with the UKMLA and AKT exam, they very much want you to know common things. Like common things are common. There might be niche things that come up here and there, but I think if you have the common things down really well, then you will be fine in the real exam, trust me. So yeah, that's what I'd first and foremost say you should do. Familiarize yourself with the content map. Now, when it comes to actually learning the information that's on the content map, there's many different resources. What I used personally was the Medicine in a Minute book. I use Zero to Finals, both the actual website and the YouTube channel. I use Ninja Nerd on YouTube, Armando on YouTube as well. For like anatomy, I use Sam Webster also on YouTube. And I had an Osmosis subscription at the time, so I use Osmosis for some like revision as well. I think just pick what's best for you. Pick what you feel most comfortable with and then work with that, because I know that the number of resources that I use can be very overwhelming. I totally understand that. And that's why I knew that I had to give myself enough time to work through things. And then I just basically go on to learning the information that I need to learn and through various revision techniques, which included pictures, drawings, songs, mnemonics, everything, whatever it was that could help me to get the information in my head, I'd use that. And then yeah, did quite well in my exam, got top 10% in my exam in medical school, got a merit award for that. And yeah, hopefully you guys can do well in your exams as well and not have to pull all-nighters, but little and often is what I'd advise. If there's any questions that you have, any additional questions, because this was like a quick overview, if there's any additional questions you have concerning the UKMLA, AKT exam, put it in the comments. I'll try and make a part 2. Thank you guys so much for watching. Hopefully that helped. Make sure you like, comment and subscribe.